Tonight, Governor Raimondo says Rhode Island is doing very well in its handling of the coronavirus. Good evening, I'm Mike Montecalvo. Today, the Department of Health reporting 49 new positive cases out of more than 2,800 people tested for a positivity rate of 1.7%. But the state's death toll continues to climb, with the Rhode Island Department of Health saying another 11 people with the virus have passed away. Number of people in the hospital is down slightly compared to yesterday. Eyewitness News reporter Kim Kalunian joins us now live from the State House. Kim?
Well, Mike, as we've been reporting, Rhode Island is trending in a positive direction, even as other states are starting to see a spike in their COVID-19 cases. And the governor says the key is going to be focusing on hot spots within the state, which continue to emerge in high-density communities like Central Falls and Providence.
Rhode Island's statewide positive rate is now less than 2%. The governor and health director say that's great news, but the disparities between communities are clear.
We know in poorer communities, immigrant communities, and densely populated communities, the virus thrives.
Raimondo says the percent positive in such places is still high. In Central Falls, the rate has dropped from 22% to 13% over the last 2 weeks. In Providence, it was between 18 and 19% and is now below 10. The same is true in Pawtucket, and in Woonsocket, it slowly declined to 6%. The governor is encouraging anyone who might feel sick in those communities to get tested. Meanwhile, she announced an expansion of asymptomatic testing, with new test sites coming to Stop and Shops in Cranston, Pawtucket, and Providence for people who went to large rallies and those in certain close contact industries. Dr. Nicole Alexander Scott says ideally those folks should be tested every 1 to 2 weeks. And while the state tries to get a better sense of where new cases are popping up, the bulk of deaths, about 75%, continue to occur inside nursing homes.
This is what we need to keep our eye on. Nursing homes, congregate care settings, densely populated cities. When the students come back, dormitories. These are the areas that we have to keep our eye on.
And state officials say they will soon begin offering asymptomatic testing to even more people. Now, you might be wondering, what is phase 3 going to look like? And what about large gatherings and maybe even a future wedding? Well, the governor says tune in on Friday. She will be giving much more guidance on that at her 1 o'clock press briefing. Live at the State House, I'm Kim Kalunian, Eyewitness News.
First at 5:30, Rhode Islanders may be wearing masks and keeping socially distanced for several months more. But Governor Raimondo says this is also an opportunity to change things for the better. Eyewitness News reporter Kim Kalunian joins us now live from the State House. Kim?
Well, Mike, the governor says she is not a fan of the phrase the new normal, but she also thinks that COVID will change the way we live our lives forever. And today she offered some specific examples.
So, for example, we've learned that there is a permanent and forever role for distance learning and virtual learning in our K-12 public schools. As we said last week, it's the end of the snow day. Sorry, Foster Gloucester and all the kids. You're not going to have snow days anymore. You're not going to miss learning. You're going to stay home and do your work in a distanced fashion. And we now know you can do it in a great, excellent way and learn a lot. We've learned that telehealth really works. It's a fantastic way to deliver health care over the phone or over video, where you can provide access to health care, in some ways at a lower cost, just as high quality, for people who have a hard time getting to the office. The same thing is true for working from home. You know, many people have continued to work from home through this crisis. And we've done a survey of businesses. 90% of businesses say that their employees are just as productive working from home as they are in the office. So we need to enable that, which means we need to think about childcare for folks who are going to continue to work from home. The DMV might not go back to the way it was. I'm sure that will be relief to some of you. You know, we've been operating very well by appointment only.
Now, the governor says things like virtual learning and telehealth won't replace in-person classes and visits to your doctor's office, but she does think it will be valuable to continue to use these tools even after the virus is under control. Live at the State House, I'm Kim Kalunian, Eyewitness News.